This charter challenge focuses on the final moments of Sam O'Neill's life in 2023. She was 34, had cervical cancer, and ultimately chose to pursue MAID. But the hospital where she was admitted would not carry out the request, and as a result, she had to be transported to another facility about 20 minutes away.
The MAID procedure goes against Catholic teachings. St. Paul's is a Catholic-run hospital, but it is also publicly funded.
When they arrived at the secondary facility, she could not be roused. So her family and her friends and Sam missed that opportunity for that last meaningful goodbye.
Legal advisor Daphne Gilbert says representatives for the hospital are arguing for institutional freedom of religion.
That even though it doesn't only serve Catholics and it doesn't employ only Catholic people, it has enough of a tradition in the Catholic faith to warrant having institutional protections.
Across the country in 2024, Health Canada received more than 22,500 requests for MAID. 16,499 people received MAID for either Track 1 requests, where the death is reasonably foreseeable, or Track 2, where the death is not reasonably foreseeable. The eligibility requirements for these requests are set out in the Criminal Code of Canada with additional safeguards. Dr. Tim Holland co-authored a paper on how physicians could interpret certain advance requests, which are currently only possible in Quebec.
The Quebec legislation has clearly said that they require contemporary suffering, but how to understand whether that individual has suffering to the degree that they would want to end their life. What we are proposing is that the way you should interpret their suffering needs to be done through the values of that person beforehand. If I don't recognize my wife, if I meet the criteria that I laid out, then I should get MAID. My advance request should be respected.
While these nuances will take time to address, Gilbert says each decision will likely have a big impact going forward.
All of these ongoing legislative and court challenges are really about reducing barriers and allowing people the autonomous choice to how they want to end their life with dignity.
Katherine Ward, Global News, Toronto.